Welcome to the tutorial on managing your anxiety for public speaking. Mark Twain once said, "There are two kinds of speakers, those that are nervous and those that are liars." Jerry Seinfeld is famous for his quote, "According to most studies, people's number one fear is public speaking. Number two is death. Death is number two. Does that sound right? This means to the average person, if you go to a funeral, you're better off in the casket than doing the eulogy." We understand that there are differing degrees of anxiety and that it's completely normal to feel anxious about giving a public speech. Most people are, but we hope that you don't want to die rather than give a speech. Even experienced speakers feel anxiety about giving speeches, so of course you're going to feel nervous if you're giving a speech, particularly for the first time and particularly for a grade. The key to improving your anxiety is to understand your anxiety and to make realistic goals. For instance, instead of saying, "I want to stop feeling nervous about public speaking," say, "I want to learn some strategies for managing my anxiety about speaking." Let's begin with understanding your anxiety. There are two types of anxiety. Situational anxiety, which is anxiety caused by factors present in a specific speaking situation, and trait anxiety, which are internal anxieties that an individual brings to the speaking situation. Let's first take a look at situational anxiety. Situational anxiety is feeling nervous in a new speaking situation. So while you might feel comfortable in one situation, in another situation, such as in front of your friends, family, peers, or for a grade, you might feel very nervous. Situational anxiety is totally normal. It's actually necessary for dynamic communication. Even experienced speakers get situational anxiety. So how do you manage your situational anxiety? The first thing to do is to prepare and practice. Prepare using your notes and your visual aids, and practice out loud. My recommendation is at least 5 times beginning to end. If you have time for more, I would recommend doing that. Warm up before speaking. Make sure you stretch out your voice, clear your throat, drink lots of water. I would rehearse your speech at least one time out loud before you actually get up to do the actual speech. So if it's in a classroom, you would do it before the class started. If it's at your home, it would be before you start recording. Exercise the morning before speaking. This is something that's worked particularly well for me and many of my students. Do a quick jog or walk, some push-ups, sit-ups, burn off some of that nervous energy. Use deep breathing to calm and relax yourself. Make sure you're getting lots of oxygen into your brain so that you can think clearly. And plan a very relaxing introduction. It's a good idea to memorize your opening line. You don't want to memorize your entire speech because that's a lot of pressure. But memorizing your opening line makes sure that you start on a really great note and that you gain confidence. Now let's look at trait anxiety. Trait anxiety is characterized by feeling dissimilar to other speakers. Maybe it's a feeling of anxiety due to prior speaking history, such as having a really bad speech class in the past or having a bad speaking event. Or a feeling in general of being subordinate to other people, like you aren't worthy of other people watching you or paying attention to you, or that you have nothing important to say. So how can you manage this trait anxiety? One of the things you can do is positive imagery, which is a very powerful tool. It's creating a positive, vivid, and detailed mental image of yourself, giving a successful and confident speech. When you imagine yourself speaking confidently, you become more confident, just as if you would actually have given that successful speech. This is true. Let's look at some steps for mastering positive imagery. Step 1 is develop the habit of positive self-talk. Avoid these negative words and replace them with positive alternatives. For instance, "I have to give a speech" with "I want to give a speech." "I ought to practice" versus "I would like to practice." "I need to get this done" with "I would enjoy getting this done." Step 2 is to refocus the negative mental pictures into positive ones. You want to picture yourself as the speaker that you would like to be, and not focus on the negative things that might happen. Identify the speaking characteristics that you would like to have. For instance, being enthusiastic, knowledgeable, wise, informed, dynamic, energetic. All of these things are positive ways to look at yourself as a speaker. Lastly, write 10 positive statements that describe those positive characteristics. For instance, I will be focused on my message, not myself. I want to get my message across enthusiastically. I enjoy sharing the information I've learned with others. I can make mistakes, but still do a great job. I want to practice until my delivery feels natural. I am worthy of others' undivided attention, and I embrace opportunities to speak. Step 3 is to read your positive statements daily. Keep the list of your statements next to your bed or on post-its in your bathroom mirror or as a message to yourself on your phone, and read them as frequently as possible. Make sure that you're allowing yourself some room to make mistakes. You're only human, and we're not expecting a perfect speech. We're expecting your best. If you are a very high anxiety speaker, go one step further. Write out a scenario, or if you're more of an auditory person, dictate your story into a recorder where you can listen to it later. Start your story wherever your anxiety begins. Write or say only positive statements until the point where your anxiety abates. Listen or read your story to yourself every day before your speech to remind yourself that you can do this. For everyone, deep breathing is a great technique to minimize your anxiety and start to manage how you feel. Practice your deep breathing by lying on your back, placing your hand on the lower part of your lungs, and filling them to the point where you see your hand rise, as demonstrated here. Breathe in and out through your nose if possible. Breathe in slowly, hold for about 5 to 10 seconds, or just start with 5, and breathe out slowly. Practice before bedtime or in your car. If you're in your car, please keep both of your hands on the wheel, because learning to remain relaxed while visualizing a series of communication situations progressing from low to high anxiety will help you ultimately. Always remember, your speech instructors are real people who care about you and want you to do well in this class. If you need help managing your anxiety, we are here for you. We've often struggled with anxiety ourselves, and we have some excellent advice for you. Please don't hesitate to ask. Thanks for listening.